She's muted.
The sound is
Melanie,
muted
I think
now.
you muted yourself.
Yeah.
Got it. Okay. Are we here?
Yes.
Can you hear me?
Yes.
Okay, perfect. So my name's Melanie. I'm Doran, the director of HR here, and I'm actually residing in the Alpharetta office today. So I just wanted to hop on. Welcome everyone. Thanks for joining. And we have a lot of information to cover in the next 58 minutes. And I'm going to hand it over to Jaimy Green with Willis Tower Watson, WTW, our broker. But I'm going to be in the chat today, taking in questions. I'll answer what I can. You know, Jaimy might hop in and answer some of those questions as well. But if we don't get to your question in the chat or throughout the presentation today, we'll be documenting those and sharing that out in a FAQ. We'll also share the recording of today's meeting. And we will also share the slide deck and information that we share today. So yeah, I'll see you all in the chat. And then Jaimy, I will hand it off to you.
Great, thanks, Melanie. Well, thank you everyone for joining today. As Melanie mentioned, my name is Jaimy Green and I am with Willis Towers Watson. So I work closely with Melanie and Victoria on your insurance benefits for 2025. We do have a few other individuals joining today from your carrier partners that will be delivering some information as well, and I'll let them introduce themselves prior to their piece of the presentation. There will be a few changes for 2025, so we've listed out the lines of coverage that you will be offered for 2025, as well as who those carrier partners will be with. So your medical and dental will remain with United Healthcare. Your vision will now also be with United Healthcare. Life and disability, as well as an EAP plan, will be with the Guardian. And identity theft protection is also offered through Allstate. You have FSA, HRA, and HSA that are all administered through Diversified Benefit Services, also known as DBS. And then UFS also offers a wellness program called UFS Vitality, and this is through Aurora Healthcare. So some of the other changes that we wanted to highlight for 2025, and again, as a reminder, a lot of this information we're going to dive into deeper throughout the presentation. So if you have questions, feel free to ask, but we will have more information on majority of the information that you'll see on this slide. So your medical plans are going to be consolidated from 5 plans down to 3. So we're removing the $250 and $500 PPO plans, as well as the $5,000 HSA plan. We're adding a $3,500 HRA plan, keeping the $1,650 HSA plan, and then we're going to add back in another HSA plan, $3,300 for the deductible for single coverage. So as I mentioned earlier, your health savings account is now going to be administered through DBS, so Diversified Benefit Services. The contributions on an annual basis will remain at $500 if you're enrolled in single coverage, and then $1,000 if you're enrolled in family coverage. The HRA, if you are enrolled in the $3,500 HRA plan, will also be administered through DBS, and UFS will reimburse you up to a maximum of $3,000 if you're enrolled in single coverage. And if you have dependents that are also enrolled, this will be up to $6,000 that they will reimburse you on an annual basis. There's a limited purpose flexible spending account that will also be offered to you. This is also through Diversified. So this will be offered if you're enrolling in the $3,300 or $1,650 HSA plan only. This will allow you to contribute up to $3,300 annually, and these funds will be used to cover your dental and vision expenses. The wellness program, again called UFS Vitality, will be used to determine your medical rates for 2025. And we'll get into this a little bit further, but there will be base rates, which means if you do not participate in the wellness program, And then there will also be wellness rates, which means that you're participating in the wellness program and you're hitting those determined metrics. Your life and disability carrier will now be through the Guardian. Your voluntary life maximum is now going to be $750,000. In addition, there is also a maximum for the voluntary AD&D, also for $750,000. There will be a few adjustments to the short-term and the long-term disability benefits, and we'll get into that later in the presentation. And then due to the IRS, there is an increase in what you can contribute to your health savings account. So if you're enrolled in single coverage and you're within one of the HSA plans, you'll be able to contribute up to $4,300. And then if you're enrolled in a family coverage, that's going to go up to $8,550. So open enrollment is open now, and you'll have an opportunity to make your elections through next Friday, December 13th. Please make sure you choose wisely and you talk through with your spouses and make sure that you're electing the right coverage for you and your family's needs for 2025, because these will be the benefits that will be in place for all of 2025. The only way you're able to make a change is if you experience a qualifying life event. And we have some of those examples of what a qualifying life event would be listed here on this slide. Also keep in mind that UFS has a spousal surcharge. And what this means is if you have a spouse that has the ability to be covered under his or own employer's health plan, but chooses to elect under UFS's plan, you'll be charged $150 per month. And I would just like to note that that $150 would be in addition to the premiums that you're going to see in the next few slides. So next steps, after you have an opportunity to review all the benefits for 2025, you can log into the ADP site, and that will be ready for you to make your elections. This year, UFS is providing an active enrollment, and what this means is your elections that you have in 2024 will not roll over into 2025. So even if you plan on not making any changes for 2024, you will still need to actively go into ADP and make your elections. The only exception is going to be with the Guardian products, which would be the basic life, short-term disability, long-term disability, and then also the voluntary life. So those will automatically be rolled over and you'll be enrolled into those benefits. Your voluntary life, also you'll be rolled over, but up to a maximum of the $750,000. So if you have any additional questions before you make your elections, feel free to reach out to either Melanie or Victoria to help guide you. The wellness program that we talked about, UFS Vitality through Aurora. So as I mentioned, the wellness program is going to help determine what your 2025 medical monthly rates are. So I'll start out by saying that due to the fact that you did not have an opportunity to earn points in 2024, for Q1 of 2025, you will automatically be enrolled in the wellness level. However, from January to March of 2025 is when you'll have the opportunity to earn wellness points. And however you earn points between that time period will determine what your rates will be for the remainder of 2025. Then from April to December, those points will be tripled, meaning you'll have to earn at least 300 points, and spouses will have to earn at least 75 points. And this will be what sets your rates for 2026. UFS also offers a fitness center reimbursement. So this means that if you have a membership at a fitness center or you have some type of a membership at home that you're utilizing, if you have proof of that, you can provide it to Victoria, and she will no later than January 27th. And by providing this information to Victoria, this will allow you to receive $15 on the last payroll of each month. And this will be for the entire year. This process will be done on an annual basis during this open enrollment timeframe. So on an annual basis, if you have a membership, you can provide that to HR for that $15 a month. So in order to start earning points for the wellness program, you can register through Aurora. We have the website here on this slide with the directions of what to do once you get out to that website. And you can start earning points right away and getting yourself set up. So Melanie is going to post a video within the chat, and it will just kind of go through, it's Aurora, and they'll be going through your wellness program to help you give a little bit more information behind what's needed, how you earn the points. In addition, in early 2025, Melanie and Victoria will be setting up a Vitality Wellness Program training. So for anyone who's interested, they'll be offered both virtually and recorded. And again, these trainings will be to showcase how to earn the points. They'll highlight the premium schedule. And then if you have any additional questions at that time, maybe once you've dove into the site and got to understand the program a little bit more, this will give you an opportunity to do so. All right, and with that, I'm going to hand it over to United Healthcare. And I did just want to make one note before they started diving in. Because you currently have a United Healthcare plan, but you're moving over to UFS, you very likely will be receiving a termination letter. Please do not let that alarm you. It does not mean that you will not have coverage if you're electing for 1/1 of 2025. You can ignore that. It basically just means that you no longer have United Healthcare plans under Safe Systems. It is now all together with UFS. So I just wanted to point that out. You get it, and it would be alarming. I would be nervous too. So just be aware that that is likely coming yet. Okay, Victor, I'll hand it over to you.
Thanks, Jaimy. Good afternoon, everyone. Thanks for having us. My name is Victor, and along with my partner, Abby, we are your field account managers for United Healthcare. We work closely with Melanie and Victoria for the overall service experience, member education, and to help coordinate wellness initiatives. And with that being said, we're going to take a look at your plans right now. So we're going to look at your plan costs, how they're broken out, and depending on which plan you choose, whether you choose a network provider or go out of the network. And by looking at the costs from left to right, you'll see that staying in the network can definitely save you some money. On the top line where it says deductible, you'll notice that the $3,500 HRA plan says embedded, while the $3,500 HRA and the $3,300 HSA say embedded, and the $1,650 HSA is non-embedded. What that means is for the embedded plans, the embedded deductible, all individual deductibles will count towards the family deductible, but an individual will not have to pay more than that individual amount. Okay. And then again, on the 1,650 HSA plan, that is non-embedded. And what that means is that if there is more than one person in the family that is covered, the family deductible of $3,300 must be met before the health insurance payments kick in. And now we talked about the HRA and the HSA, and in a few minutes, Tony from DBS, he'll cover all of that and be able to answer any of the questions that you may have. If you take a look at the first plan, the $3,500 HRA, we're just going to look at the in-network costs. The individual deductible is $3,500, whereas the family deductible is $7,000. The out-of-pocket maximum, meaning the maximum amount you'll pay in the year for the individual is $6,350, and the family is $12,700. And then once the deductible is met, the co-insurance, that's the part that you're responsible for up until the max out-of-pocket is met. You're responsible for 10%, meaning the health plan covers 90 and you pay the last 10%. Moving over to the 1,650 HSA, the non-embedded deductible, the individual deductible is $1,650, while the family deductible is $3,300. The max out-of-pocket is for the individuals $4,000, and the family out-of-pocket is $7,350. Again, we're looking at a 90-10 ratio. So once you hit the deductible, you're responsible for 10% after the deductible is met, and the plan pays the other 90% for you. On the far right, on the $3,300 HSA plan, The individual deductible is $3,300 and the family deductible is $6,600. The max out of pocket, again, the most that you'll pay out of pocket for the individual is $6,600, whereas the family is $13,200. Now the coinsurance on that plan is an 80-20 split, meaning once you hit the deductible, you'll be responsible for 20% up until your max out of pocket is hit. Moving on to the next slide. Taking a look at the prescription drugs, you'll notice that the $3,500 HRA plan, the drug plan that was selected for that plan comes in 4 tiers, whereas the 2 HSA plans have a 3-tier drug plan, which is why you see NA are not applicable under those 2 plans for tier 4. That just means that any drugs in that formulary, there aren't 4 tiers. There's only 3 to choose from. And in a few slides, I'll go over what those tiers mean. But the prescription drug list, those are commonly prescribed medications that are covered by the plan. Again, they're organized into tiers based on the cost level. So just so you know that choosing medications in lower tiers may save you some money, while medications in the higher tiers may cost you a little bit more. Taking a look at the first one, the $3,500 HRA, you'll see that they give the copay for $15 for tier 1, $45 for tier 2, and then tier 3 is $85 and tier 4 is $200. On this particular plan, there is no pharmacy deductible, there is no deductible, so those are the copays that you pay for your prescriptions right out of the gate. And then the mail order pharmacy through OptumRx is also available for you up to a 90-day supply, and those copays are listed right there. Now, with the 2 HSA plans, you'll notice that they say after deductible. So those copays for those drugs, the $10, the $35, and the $60, those are the copays that you will pay after you've met your deductible. Okay. On the next slide, please. We'll show the annual or the monthly premiums, and Jaimy will go over those for you at this time.
Thank you, Victor. So as we mentioned before, your rates will now be broken up between base and wellness rates for 2025. So here on this slide, you can see each plan design, the 3,500 HRA, the 1,650 HSA, and the 3,300 HSA. And then depending upon the tier that you decide to enroll in. So the base rates, as you can see, if you're not participating in the wellness, these will be higher compared to the wellness rates if you're participating in the wellness. And again, just as a reminder, for Q1 of 2025, you will be grandfathered into the wellness rates. Right, Victor, back to you.
Thank you. So now we're going to take a look at 2 nice, easy, convenient ways for you to access your plan. One way is through the myuhc.com website. The other way is through the United Healthcare app, which can be downloaded on your smartphone or your tablet. So once you're a United Healthcare member, or if you already are, you can use your ID number to set up your One Healthcare ID, and that ID and password will be used for all things United, whether it be online or on the app. And once you register, it becomes a personal website for you, which you can access 24/7, and it allows you to look up providers, to check on your claims and plan balances, and view the rewards that you've earned. You'll also be able to find costs and estimate how much it would cost. You can do your video chat with your providers. And the nice thing about it too is you can also access your health ID card. So if you forget it, you lose it, you're out and about and you need it, you can download off the app onto your smartphone, and you can store it in your digital wallet, and it'll work just as good in the provider's office. So you'll always be able to have that with you. Again, both of these are available to you 24/7, and it's a nice way to monitor all of the things that are going on within your health plan. On the next slide, we're going to talk about prioritizing care that helps you stay healthy. So keeping up with your preventative care is a great way to stay on top of your health. Most of our plans, including the ones that you see in front of you, cover the preventative care at no additional cost when you see network providers. So what that means is you'll pay $0 out of pocket for preventative care services like your annual checkups, as well as certain health screenings and vaccinations. The preventative care visits, they're great times to establish a relationship with your primary care provider, since this PCP they'll be your go-to and your ally in your healthcare journey. It also allows you to create a connection that will help guide you in the right care for future medical services. And if you do keep up with your annual exams and the recommended screenings, you may be able to identify small issues before they turn into big, larger issues. Next slide, please. So to help you find safe, timely, effective, and efficient care, United Health Premium Program, it uses national evidence-based measures to evaluate physicians in various specialties. And the way you can locate these premium care physicians by visiting myuhc.com or the United Healthcare app, you click on Find a Provider and you look for the 2 blue hearts, and that's part of our premium program. So you know that you're using doctors that have met certain criteria to be placed at this level. And as we move on, when you want to find a network provider, a couple of easy ways to do it. You can go to uhc.com and the provider search. What you'll do is you'll choose medical directory. If you're not, excuse me, this is if you're not already registered. If you're not registered, you go to uhc.com, click on medical directory. You'll choose employer and individual plans, and then you'll select the plan that you are going to be enrolling in. And in this case, it's Choice Plus. And once you do that, you'll be able to enter your zip code, and then you'll be able to see the doctors that are in the network in your area. And if you are already registered and are already a member, your plan will auto-populate for you. The providers that are in the network will auto-populate for you. On the next slide is what we talked about earlier, the prescription drug list. Again, it's commonly prescribed medications that are covered by the plan. The drug list is organized into tiers, and it's based on cost level. Again, choosing the medications in the lower tiers may save you money, while the higher tiers may cost you a little bit more. Again, the HRA plan is the plan that has the 4 tiers, and you'll see that tier 1 is the lowest cost, tier 4 is the highest cost. Tier 1 is mainly generics, whereas tiers 2 and 3 are a mix of brands and generics. And then the 2 HSA plans are the 3-tier, and it's the same criteria: low cost to mid-range cost, mostly generics in tier 1, and a mix of brands and generic drugs in tiers 2 and 3. Again, the lower tiers will save you a little bit of money in the long run. But again, work with your doctor, with your provider, to make sure that you're getting the right medications. On the next slide, United Healthcare, we are taking an important step in our efforts to make prescription drugs more affordable by eliminating the out-of-pocket costs for medications that are critical to maintaining the health of you all, which are our members. With the Vital Medication Program, what it does is it offers select medications at a $0 out-of-pocket cost, and some of those drugs in the Vital program include insulin for rapid, whether it be rapid, short, and long acting, the epinephrine for allergic reactions, the glucagon for hypoglycemia, naloxone for opioid overdose, and albuterol inhalers for asthma. So to find a full list for details, you can go to myuhc.com and click on prescription drugs, and you can search the Vital Medication Program where the drugs are available, which ones are available. On the next slide, a nice way to save time on filling your medications and saving a little money is through the mail order program. You're able to get up to a 90-day supply shipped to your house with no shipping costs. What it allows you to do, it allows you to save time, so you don't have to run to the pharmacy when you're about to run out. You can access the mail order through the app, and you can also set up auto refills, which helps with maintenance medications. Maintenance medications are medications that you take regularly. So taking advantage of the home delivery service is just another way to save some time and some money, save some money for you. Moving forward to the add-ons, these are the benefits that are embedded into your health plan. And the first one that we're going to look at is the 24/7 virtual visits. So when you're not feeling well and reaching a provider by phone or video call, it's not only more convenient, it's also a way to save you some money on care. The average cost is less than $54. Some of the plans have $0 copays for you. So you can set up what it allows you to do. It allows you to not only save money on care, but it allows you to set up a virtual visit when and where you need it by visiting myuhc.com, or on the app there is a button to click for virtual, and it'll take you to another screen where you'll be able to set up an appointment with a virtual physician. And this is great if you have a cough, a headache, sore throat, and depending on the symptoms or the severity, the provider on that virtual call may also be able to prescribe medications based on your needs. On the next slide, one of the things that we're very involved with is behavioral health solutions. And one of the things that we've done is we've partnered with Calm and Calm Health. Calm Health is an app that is included in your health plan at no cost to you. It is designed to help you find your path to a happier, healthier lifestyle. The app provides plans to help support your mental and physical well-being. The nice thing about this is that the app itself is self-guided, so you get to go at your own pace. And when you're working on things at your own pace, it allows you to work on goals such as better sleep, building skills to manage stress, whether it be at home or at work, and developing and starting to build mindfulness habits. Again, the nice thing about this is that it's free. You can download the app on your phone or on your tablet, and you're able to go at your own pace. So it's all part of helping support your journey to a better emotional health. Next slide, please. The Employee Assistance Program. I know that earlier Jaimy mentioned that it's offered through another program, but it is also a program that is embedded in your health plan. And so when it comes to behavioral health, sometimes it just helps to have someone to talk to. With EAP, you can reach an EAP coordinator any time of the day or night, either online or by phone. This is to help improve relationships, find overall support, seek help with recovery. And the other thing that we can't stress enough is that the EAP conversations are confidential. So it's always going to be between you and them. And they can also offer referrals to expert care and services if those are needed. Moving on to the United Healthcare rewards. Really, what's better than earning rewards for reaching goals and taking care of your health? It's being able to choose how those rewards are earned, and that ranges from completing a health survey to even tracking your sleep. With UHC rewards, you can earn up to $300, and it's all included in your health plan at no additional cost. So once you're a member, you can check out the United Healthcare rewards on the app or again at myuhc.com, and you can choose reward activities that are right for you. And when we get to the next screen, I'll kind of show you how it breaks down a little bit. But one of the things that I wanted to point out is that if your health plan is renewing, you have 120 days to redeem the previous year's rewards. That 120 days starts the day your plan renews, so on 1/1. So if you don't redeem the rewards, you do lose them, but they do start up again with the new plan year. On the next slide, you'll be able to see the breakdown of some of the rewards that you can earn simply by connecting a tracker. So connecting, a Fitbit or your Apple Watch, you can collect $25 for that. There's a daily goal for tracking your steps, using a virtual visit, or even the annual checkup now in the flu shot. With the annual checkup, that's claims based. So once the claim has been processed on our end, your rewards will be updated. Again, you can earn up to $300 in the rewards. On the next slide, one of the nice things that's nice about it is you can also try to earn off. you can earn an Apple Watch, or not earn an Apple Watch, but if you're interested in one, you can use your reward money to help pay off an Apple Watch. And that's typically, you can get one for low or $0 up front. And then what you can do is you can put your UHC rewards earnings toward the remaining balance and pay it off over the next 12 months. So again, it's just a nice way to kind of treat yourself for keeping up with those healthy habits. Next slide, please. Next thing we're going to talk about is One Pass Select, which is our gym membership program. So no matter what your fitness interests or goals are, One Pass Select, it's designed to keep the flexibility to help meet your needs. The membership is organized in the 4 in-person fitness tiers, all the way from standard to elite, and 1 digital only tier. So you do have the flexibility in cost as well as location. The gym network, if you choose to go in person, onepassselect.com, you're able to punch in your zip code, and the gym's locations that are in your area will populate for you. Now, if you prefer to work out with company, you are able to add unlimited eligible members as long as they are 18 years or older to your existing account. Now, they can choose any membership tier that they want, and you'll get 10% off of their membership. So it's not, you can't add 4 people to your one cost. Everybody has to pay their own membership amount. On the next slide, you'll see the amounts for those tiers, all the way from classic, standard, premium, elite. Some of the boutique locations, like in Orange Theory, those might fall under the elite program. And I had mentioned this yesterday. I like to point out the elite tier. I know it's the priciest one, but it's easier to explain that if you go with something like that, everything that falls in below it, the premium, the standard, classic, everything that falls in those tiers, you get with the elite tier. So you have access to thousands of gyms nationwide. You can have more than 1 membership at a time. So, you want to go to Anytime Fitness in the morning, Snap Fitness in the afternoon, or whatnot. You're able to do that, and it all falls under the 1 monthly cost. Next thing we want to talk about is making some lasting change with the Real Appeal. What it is it's a healthy lifestyle and weight management program, and it's designed to help you build better habits across key areas such as your nutrition, your fitness, sleep, and stress. Now, this is a 52-week program, but you're never alone. You always have someone in your corner that is guiding you. What this program does include, it includes online coaching, which offers you the encouragement based on your lifestyle and your goals. It provides you with a success kit, and what this kit includes, it includes both a weight scale, a food scale, along with healthy recipes and some workout equipment. It also comes with, or has, an online dashboard that helps you set your goals, track your progress, and stream your workouts, and much more. So it's just a nice way to, if you want to work on healthier habits, it's a nice program to get involved with to work on those goals. So even if you feel that you're ready to quit smoking or vaping, a lot of people still find it difficult to quit on their own. So part of the plan, it's called Quit for Life. And with Quit for Life, you'll have a coach on your side and a personalized action plan, which hopefully makes it easier for you to leave tobacco or nicotine behind. The program also includes an online course as well as support. It also comes with the Quit for Life app and resources to help control your cravings. With that, I will now turn it over to Tony, and he's going to go over your HRA and your HSA.
So I actually don't think we have anybody on from DBS, so I will present the next several slides.
Okay, I turn it over to Jaimy to go over the HRA and the HSA.
All right, so first we're going to cover the health reimbursement account. And again, this is through Diversified Benefit Services, also known as DBS. So your HRA is going to be only if you are enrolled in the $3,500 HRA plan. And all will be funded through DBS. UFS is funding up to a maximum of $500, excuse me, up to $3,000 if you're in single coverage, for example. So if you look at what the deductible is from a single coverage standpoint, being at $3,500, you will cover the first $500 of that deductible, and UFS will reimburse you the remaining $3,000. And then for the family coverage, that would be $1,000 that you would be responsible for, and then UFS will reimburse the remaining amount of your deductible. So these HRA funds can be used for only in-network and approved claims, so not towards your premiums. It's very similar to how your HSA account works now. In order to reimburse your claims that you have, you're going to submit a claim to DBS. The most frequent way to get reimbursed would be if you take your EOBs, which is your explanation of benefits, or your prescription drug tags, and take a picture of them, and you will submit it into the DBS portal site. You can also submit it online. You can submit it by mail. You can do fax, whatever is easiest for you. But once you get that EOB and you submit it, that will trigger that reimbursement to go through from UFS. So once you submit a claim, the reimbursement is always going to be received by the following Friday. So example, if today you submit a claim, it's Tuesday, and it all goes through, it's approved, you will receive that reimbursement by next Friday, the 13th. So here's a schedule to help break out what that will look like from a reimbursement standpoint. So as I mentioned before, if you're enrolled in single coverage under the $3,500 HRA plan, you will be responsible for the first $500 of your deductible, and the rest of the $3,000 will be reimbursed through the HRA by UFS. And then the breakout for family coverage is also provided below. So the reason you'll see two separate breakouts, the first 500 being that you pay, and then the $3,000 that you pay, and then you see again the next 500 is what you pay. And the reasoning for that is because as a family coverage, you and, for example, a child will not have to pay the same amount twice. So for example, I hit my first $500 that I pay, and then I'm reimbursed after that. My child on the plan also has claims and now hits the first $500 that we pay. The rest is reimbursed by HRA. A nice feature that UFS also offers is a dental reimbursement. So if you are enrolled in the dental plan, UFS will reimburse you for the deductible. So if you're enrolled in single coverage, that's a $50 deductible that will be covered by UFS through the reimbursement schedule. And then if you're enrolled in the family level, $150 of that deductible will be reimbursed by UFS as well. All right, so next we'll talk about the HSA, so the health savings account. Some of you probably are already familiar with this, being that you had HSA plans offered. So now we are looking at either two options for an HSA plan in 2025 between the $1,650 plan and the $3,300 plan. So if you are enrolled in either of these plans, you are eligible to open up an HSA account. UFS will contribute, same as existing today, $500 for single and $1,000 for family or any dependent coverage. And this HSA account will help you pay for any qualified medical expenses. Just keep in mind that based on your current HSA funds, if you have one, you will still need to ensure that what you have saved today and then whatever is going to be rolled into 2025, along with UFS contributions, will need to go towards the IRS limits of the single example $4,300. So if you are enrolled in the single coverage, just be sure that you subtract out what you currently have saved current. And then you also subtract out, for example, the $500 that's going to be contributed by UFS. So you just don't want to exceed those limits that are set in place by the IRS. If you are 55 and older, there is what's called a catch-up contribution. And this actually allows you to contribute up to an additional $1,000. So if you're enrolled in single coverage and you're over the age of 55, you actually are able to contribute up to $5,300 instead of $4,300. And same with family coverage as well. So qualified HSA expenses. When can I use my HSA funds? You can use them for most medical, dental, and vision services, as long as you're within the high deductible health plan, which would be in either of your HSA plans. You can use this money to help pay for any of your medical expenses for yourself, your spouse, or your children. If your spouse and your children happen to be on another plan, maybe through your spouse's plan, that through their employer, you can still use those funds to help pay for those medical expenses. So it's not just limited to you. As long as you are the account holder, you have the opportunity to help pay for expenses with your HSA funds for your whole family. So same process, similar to how the HRA is. You will receive a debit card through UMB, which is the trustee bank through DBS. And you can go ahead and utilize that HSA card when your funds are within that account. You can also submit a claim and transfer those funds over through the portal, through the DBS portal, and pay online. I know there was a question earlier, so just in case if anyone was watching or not watching the chat, if you currently have your funds through Optum Bank and you'd like to keep those funds in that account, you are welcome to do so. Like I mentioned before, just make sure that you're including that total fund that you have within that account into what your total will be for 2025, so you don't exceed those IRS limits. If you want to transfer those monies that you have through Optum into the UMB account, there will be a form that will be provided that you can complete. This form will specifically go right to Optum, and then this will trigger the transfer of all of your funds that you have in your Optum bank over to DBS. All right, so now we're going to look at some flexible spending accounts, and there are several. So the first one we're going to look at is healthcare flexible spending account. So if you choose to enroll in the $3,500 HRA plan, you will be eligible for the healthcare FSA. And this will specifically be to help pay for medical, dental, and vision. So since you're in the HRA plan, you cannot open up an HSA account. This offers an additional bucket of money for you to help pay for your medical expenses. You can contribute up to $3,300 annually. You don't have to contribute that much, but you're welcome to contribute up to that amount. And UFS also offers a provision called the carryover provision, which would be $660. So this means that at the end of 2025, if you have $660 still left in your account, in your FSA account, that amount can roll over into 2026. But still be sure that you kind of take a look at what you have for expenses coming up for 2025. And these contributions that you make will be taken out on a pre-tax basis on your payroll each paycheck. Some of the expenses that you can use to help pay for with your FSA, with your healthcare FSA specifically, would be things like your deductible, any medical copays, your dental deductible, which is already covered through the HRA, which will be reimbursed. But then you also have like dental expenses for cleanings or fillings, caps and crowns, braces, and then also vision expenses. So your glasses, your frames, contact lenses, you can save up and bucket the money to pay for some of those larger items that you don't want to pay out of pocket for. And then also prescription drugs too, and over-the-counter drugs. Again, the process for reimbursement is similar to what we've already mentioned in the past. You will go out to the portal, you'll file a claim using your phone, you take a picture, you can mail it, you can fax it, and then your balance will be updated based on your claim amount that you're submitting. So if you submit a claim for, say, example, $100, but you only have $50 in your account, you're only going to get reimbursed that $50. There's not an option at that point for you to get the full $100 until it's in your account. So just as a heads up, if you are submitting a claim that's more than what you have in your account, you will have to wait for the remaining of those monies to get into your account. You also have the option to enroll in a limited purpose flexible spending account if you are enrolled in the either HSA plan, the $3,300 or the $1,650. So this account will help you pay for just dental and vision expenses. And again, this can be for you, your spouse, or your dependents, regardless of how you have enrolled you and your family into the medical plan. The limit is the same as what we just mentioned prior. So the $3,300. This again will be taken out of your paycheck on a pre-tax basis, and it also has the $660 carryover provision in place as well. Very similar to what we talked about prior from a dental perspective, some of the eligible claims can be from the dental expenses like exams, the cleanings, fillings, braces, and same thing with the vision again too, glasses, frames, contact lenses. So really just offering another way for you to help pay for expenses depending upon either plan that you're enrolled in. And then lastly, dependent care flexible spending account. So this account allows you to help pay for daycare expenses or adult care if maybe they're unable to care for themselves. This account you can actually contribute up to $5,000 a year. However, for this account, be very wise when you choose how much you want to contribute, because whatever monies you don't use by the end of the year will be forfeited. So they look at this account as a use it or lose it. So whatever you have left will just be lost. So make sure that you calculate, if you have daycare costs, what that will look like for the year. And again, this will be taken out of your paycheck on a pre-tax basis. So you can kind of calculate what that would look like on a monthly basis. And same thing when you submit a claim, check with your daycare provider, for example, and make sure that they are able to, that you're able to file a claim with them and that you're able to have them sponsor dependent care. And if they are, calculate what you're paying on a bi-weekly or a weekly basis, and that's how you can elect for the year. And we did talk about the cards that you'll be receiving as well for HSA. All right, so your dental benefits for 2025. As we mentioned before, the deductible, so $50 for single and $150 for family, will be reimbursed through the HRA. And then there you can see your annual limit of $2,000. You also have ortho coverage for both adult and child. And then you'll see at the bottom what your monthly premiums will be based on the coverage tier that you decide to enroll in for 2025. And then your vision benefits are also with United Healthcare. So here you can see what your copay amount will be for eye exams, materials. Your frequency for eye exams is 12 months. Your lens frequency is 12 months. And then your frames is every 24 months. And then you'll also see the monthly premiums listed below again, depending upon the coverage tier that you elect. All right, we have about 10 minutes left, so I'm going to hand it over to John from the Guardian, and he is going to discuss your life and disability products.
Thanks, Jaimy. Yeah, John here from Guardian. We'll talk about, as Jaimy said, the life and disability, and then also touch on the EAP here quickly as we're wrapping up this presentation. So first off is the base life and AD&D. So that is a $100,000 flat benefit, and that is for employees only. And this is paid for by your employer. So this is nothing that comes out of your checks. This is paid for and is a nice benefit offered to you. Voluntary life and accidental death and dismemberment is also an option for you. And from what I understand, we are grandfathering in any existing amounts that you currently have with your current carrier over to Guardian effective 1/1. And the benefits here are maximum life and AD&D benefit of $750,000 for employees, $250,000 for spouses, and $10,000 for child or children. The benefits, both life benefits, do reduce as you get older. So 35% reduction at age 65, 50% reduction at age 70. And they also do include portability and conversion. So what that is there's two different options for you. If you were ever to leave the company, there are options that you will be able to take this life insurance with you upon termination of employment. Life insurance also has an accelerated death benefit, which is if you're diagnosed with a terminal condition, you can draw from your life insurance benefit early. And then also waiver of premium. So if you ever were to become disabled, after a certain period of time, we will, if you're disabled and unable to work, the premium for this coverage will be waived. Next slide. And now we'll go on to short-term and long-term disability. So it is kind of in the name. Short-term is for brief periods of disability that might come from an illness or an injury that will render you unable to work. And long-term disability is more of a longer duration, and it's paid out in a monthly fashion. So I'll go into a little bit more about the two disability plans that you have on the next slide. So for the short-term disability, this is going to be in addition to the UFS pay continuation program that you have. Guardian is going to pay 40% of your weekly pay up to $100 per week, and those benefits can last up to 24 weeks. There is a 2-week waiting period, so the first 2 weeks after your disability, you're not eligible for anything. Payments start then weekly after that, and again, last up to 24 weeks if you're unable to do your job. And if you're still disabled after 180 days, you'd move over to the long-term disability plan. And this is a monthly plan. So this is going to be paid at 60% of your monthly pay, up to $10,000 per month for the benefit. This kicks in after 180 days, and the total maximum that this could be paid out is to Social Security normal retirement age. So a lot of people, that's going to be age 67. Next slide. Okay, and as I mentioned before, you also have access to an employee assistance program, or EAP. And what that is a program provided through Uprise Health, and that's one of our partners, and it offers services to help promote well-being and enhance the quality of life for you and your family. This program provides confidential, online, and coach-guided support on a wide variety of important and relevant topics, from stress management, dependent and elder care, nutrition and fitness, and legal and financial issues. You can see some of the highlights there on the screen. Most common and most utilized probably is the 3 in-person or virtual visits for counseling to help through any mental illness or emotional concerns. And how do you get, next slide, please. And for more detail on this program, you can log into the website at at worklife.uprisehealth.com. Use the access code WORKLIFE. So you can either access it through the internet, or they also do have an app that you can download to your phone or tablet. Or if you'd like, you can call the 800 number there on your screen. That's it.
Thank you, John. Lastly, UFS offers, as I mentioned earlier, an identity theft protection program through AFLAC. Here you can see on the screen in the chart that if you choose to enroll in employee-only coverage, UFS will pay for 100% of those premiums. If you enroll with dependents, the monthly rate is shown here at $13.96. Some additional benefits that are sponsored by UFS that you can look forward to for 2025 are listed here. There's the matching gifts program, and this program would be for people-focused donations that are matched by UFS for a maximum of $100 per calendar year. They offer the Child Fundraiser Donation Program, and this would be for all dependent children of employees, and UFS will donate $100 per dependent child per calendar year. UFS offers volunteer time off. So this would be for any employees that were hired prior to June 30th would receive 8 hours of VTO to be utilized by December 31st. And then anyone who was hired after June 30th would also receive the 8 hours of VTO on January 1st of the following year. UFS offers a 401k plan, and UFS will match 100% of the employee contribution up to 6% of your salary. There will be some informational meetings scheduled by your 401k provider. So if you have any questions, that will be the most appropriate time to ask those. And that concludes our 2025 open enrollment presentation. So I know that was a lot of information. We tried to keep up in the chats as much as we could with your questions. We appreciate your engagement. If there are any additional questions that you may have, please feel free to reach out to Melanie and Victoria, and we'll get those questions answered as quickly as possible. So again, last reminder, please feel free to go out to the ADP site and start figuring out what you want for your elections in 2025. You have from now until December 13th. And after December 13th, depending upon what you elected for 25, that is what your elections will be. So there are not any other opportunities to make changes after December 13th. So thank you everyone very much for your time. We appreciate it, and we hope you all have a great day.